Good morning. This is Mary Daniel, and I'm a student nurse here to perform a health assessment. I have been presented with a patient who is having crushing chest pain. So let's move on further with the history collection, inspection, palpation, and auscultation. Hi. Hi.
Hello.
My name is Mary Daniel. I'm a student nurse for you today.
Okay.
Can you tell me your name?
My name is Gibson Jacob.
Okay. What's your date of birth?
9th March 1989.
Okay. Perfect. So this is just to check your identity.
Yeah, okay.
Okay, fine. So what brings you here today?
I have chest pain when I was removed snow in the morning.
Okay. So can you describe something about your pain? Like what makes it worse or better?
Or nothing.
Okay. So you said like you had this chest pain since morning, like when you were removing the snow.
Yeah.
Okay. So what does the pain feel like? Is this crushing pain? Is this pricking kind of pain? Or is it any kind of pulling pain? So can you tell me something like what does it feel like?
Yeah, like crushing pain.
So that means you have crushing pain.
Yeah.
Okay, perfect. Okay. So where do you have this pain? Is it towards your right side or towards your left side? Where is it?
In the left side.
So you have chest pain in the left side.
Yeah.
Okay. I would like to know whether does it radiate anywhere?
Sometimes it's radiating left arm.
So your pain is radiating towards your left arm.
Yeah.
Okay. Perfect. So it is radiating towards your left arm. Okay. So can you rate your pain like from 0 to 10, 0 being no pain and 10 being the worst pain? So how do you rate your pain?
Okay, I rate around 8.
So that means it is something severe.
Yeah.
Okay. So I would like to know something more about this pain. Would you mind asking me that?
Oh, no.
Okay, fine. So how long do you have this pain?
Around 10 minutes.
So you have around 10 minutes this
Yeah.
pain. Okay. So did you have this pain before?
No, in the first day in the morning.
First time in the morning. Okay. So it started in the morning and it took around 10 minutes to go off. Okay, fine. Fine. So what do you think? What kind of pain is this? What do you think?
No, it's nothing. Something like left. That's why I came here.
Okay, fine. I would like to know something about your health history and your family history as well. Would you mind asking me that?
No problem.
Okay, fine. So do you have trouble in breathing?
No.
You don't have any trouble with
No.
breathing. Okay. So I would like to know whether the chest pain is hindering any kind of activities or your usual work. Is this hindering?
No.
Okay, fine. So I would like to know also, I would like to check your cyanosis as well as your pallor. So would you mind showing me your nails?
Yeah, of course.
Okay. Okay, fine. So you don't have any kind of cyanosis or pallor. So do you have swelling on your feet, on your leg, or anywhere else? Like, do you have any kind of swelling?
Oh, no.
No. Okay. So what about your urination? Is it normal?
Yeah, normal.
Okay, fine. So I would like to know your past history as well. So do you have any other health problems other than this chest pain?
Yeah, I have one cholesterol in last 5 years.
Okay,
I
so
think-
you have cholesterol since 5 years.
Yeah.
So do you take any kind of medicine?
Some medicines I take.
Okay, since 5 years you are taking the medicines. Okay, so do you take any other medicines other than this?
No, nothing.
Okay, fine, perfect. So okay, I would like to know even about your past history. Would you mind asking me that?
Yeah, of course.
Okay, fine. So did anyone among your family members have any kind of cardiac history?
Yeah, my father had MI, and at the age of 65.
Okay, perfect. So your father had MI at the age of 55. Okay.
At the age of 65.
Okay, fine. Perfect. Okay. So I would like to know even your personal habits as well.
Yeah.
So what about your smoking? Like, do you smoke?
No.
You don't smoke? Okay. So do you take alcohol?
No. Sometimes I take red wine.
Okay. So that means you take a red wine. Okay. Is it daily?
No. Weekly.
Weekly. Okay. Weekly once?
Once in a week.
Once in a week.
Yeah.
So you take, you just take red wine once in a week.
Yeah.
Perfect. So we have completed with the health assessment.
Okay.
So let's, I need to know more about what kind of the pain you have. So I need to inspect your chest. I need to palpate. I need to auscultate your chest sounds as well. So would you mind me doing that?
Yeah, no problem.
Okay, fine. So let's continue with that.
Okay.
Okay, fine. So next we'll move on with the further assessment, that is auscultation. So I would like to have your shirt buttons removed. If you don't mind, can you please
Okay.
move
No
it
worry.
aside?
No worry. Okay.
Yeah, fine. Okay. So I would like to check for your heart sounds.
Okay.
So I would like to ask your permission for
Yeah.
having it auscultated. Okay, fine.
No problem.
So this is the notch, that is clavicular notch. Here comes the bulge. Moving downwards comes the bulge, that is called the angle of Lewis. Next is the first rib, followed by the intercostal space, and moving downwards is the second rib, followed by the intercostal space. So towards the right side of the heart, towards the right side is the aortic valve, and that is the second intercostal space, and pulmonic valve is towards the left side, that is towards the second intercostal space. Moving downwards to the fourth intercostal space is called the tricuspid valve, and from there moving downwards to the fifth intercostal space that comes mid-clavicularly, that is exactly at the middle of the clavicle, just below the nipple, is called the mitral valve, that is towards the fifth intercostal space. So next we'll see with the bell of the stethoscope, that is second intercostal space is towards the right side is the aortic valve, and pulmonic valve is to the second intercostal space of the left side, and moving downwards to the fourth intercostal space is the tricuspid valve, and the fifth intercostal space gives the mitral valve, that is just below the nipple or the mid-clavicular. So next we'll see for the S1 and S2 sounds. S1 can be heard at the tricuspid as well as mitral. Tricuspid valve and the mitral valve gives the S1 sound, which means S1 lub dub, that is lub is louder, lub dub, lub dub. That means lub is louder and the dub is slower. And S2 sounds can be heard at the aortic as well as pulmonic, that is in the second intercostal space. So here lub is slower and dub is higher. That means lub is slower, lub, dub, lub, dub. So S1 is heard at the tricuspid as well as mitral, and S2 is heard at the aortic and as well as pulmonic. So next we'll see the apical impulse. Apical impulse is exactly located here, that means in the fifth intercostal space, that is mid-clavicularly here. So here, after checking for 1 minute, which seems above the normal limit, that is normal is between 60 to 100. So which is above the normal limit, is above normal limit, apical impulses can be heard after checking for 1 minute. So apical impulse is located exactly at the fifth intercostal space. So next we'll move on to the inspection as well as palpation. So I would like to see the entire chest, to see whether the chest is symmetrical or not, or do you have any other findings or not. So as per the observation, I don't think like you have any kind of swelling or any kind of tenderness or something like that. So we'll go with the palpation. So apical pulse is seen here, that means exactly here, that is fifth intercostal space below the nipple line, that is 1 to 2 centimeter of the fifth intercostal space. So mid clavicularly, they're just below the nipple line. And we also look for the apex, base as well as the sternal border. So the apex is called here, that means the bottom of the heart is called the apex, as well as the base is called, the topper part of the heart is called the base. And the sternal border is exactly here, which shows perfect. So yeah, that's it for the inspection and as well as palpation. You can just close your shirts.
Okay.
So I'll note down the writings and we'll move on with the further treatment. Okay?
Okay.
Is that okay? Okay, fine. Yeah,
Okay,
thank you.
Thank you.